Welcome back to Electrolysis Unplugged, the after-hours chat beyond the probe. I am Stephanie Shields, and today I am flying solo, but I promise that we've got some important and I would say a fascinating topic to dive into. If you ever wondered why electrolysis feels the way it does, why some areas are more sensitive than others, or how you make a treatment as comfortable as possible, whether you're a technician or a patient, this episode honestly is for you. We're going to break down the science behind pain perception and how nerves respond to treatment and real-world strategies that can make electrolysis more comfortable for both clients and electrologists. So let's jump in. This is Electrolysis Unplugged with your solo host today, Stephanie Shields. Hey, everybody. So tonight, I was going to do like a back and forth with Joanny talking about like the science of sensation and understanding like pain and nerve response and comfort and electrolysis. And I totally have notes because I was like, oh my gosh, she's stuck at work and I have got to do this solo. So you might see me looking off camera so I can make sure I stay on track because I had to make sure that that was going to happen. But I really felt that this was one of those topics that it's kind of built not only for you guys, the electrologists, but it's built for your patients. Because if you, or clients, depending on if you're clinical or not, if you struggle with being able to describe the sensation of electrolysis or find the words that are, I would say, a peaceful way for you to describe we're about to embark on, especially in certain sensitive or more sensitive areas of the body. I think that this is a great opportunity to maybe utilize this dialogue with patients, or if like down the road when this is like released as the pod, for people to understand when they're consumers that electrolysis is not necessarily like kitten kisses. It is a rough treatment in certain times. And depending on the severity of the case in front of you, or the pain threshold of a person, or heck, when the wind blows west wrong, okay, it can be a rough day for some people. And then you'll have other individuals that just sleep or dissociate, and they can go to la la land and utilize a lot of different tools to then help them get through the process. I myself, when I had my electrolysis done at 12 years old, I would go to the dentist ahead of time and have them block my upper lip because I was 12. I didn't have a pain threshold really at that point because when you're that young, hopefully you have not gone through substantial traumatic stuff that has caused pain. Not to say that little kids don't, but we kind of build our tolerance as we grow older because we go through more stuff as we get older, hopefully, right? And so I would do the upper lip injection at the dentist, and then I would have my upper lip cleared. Into my teens, when I started getting laser more frequently, and I had, that ample amount of dark volume, dense, thick hair, that's like what lasers eat for dinner, right? And because of that, it also makes it more uncomfortable. The more it can see, the more it's targeting, the more uncomfortable it can be. And I would even say in those years, it was still uncomfortable for me, but I couldn't utilize something like a numbing cream because I was doing large areas of my body, and that could be a high risk. And so when I was going through that, we would have to do like pulse counting, right? So every time we'd fire the laser, 1, 2, 3, 4, 5, breathe, 1, 2, 3, 4, 5, because I had to have those breaks to get me into that space. So I think that this conversation today, and like I have the chat open, so if you guys want to drop questions in there as I'm talking, feel free to. But I think this is a great opportunity for us to start talking about like how nerves respond, that there's still some questions. Colleague of ours in Canada, Kim, she is the Canadian president of COPE. She had done an amazing lecture last year when I was up in Canada with her spouse in regards to understanding pain and electrolysis. And one of the conversation points was we have talked about synapse fatigue as electrologists forever. And as they were researching for their lecture, they found that synapse fatigue is one of those weird words that we use on the regular to explain what's happening to the body during that time. But traditionally, the amount of speed you would have to work in that time frame to cause that kind of discomfort would not be described as synapse fatigue with electrolysis, because usually like tattoos how fast it's going, the repetition there. That leads the brain to synapse fatigue in the truest form of it, rather than someone that is like, doing like repetitive slow movement. It will put an addendum in there. Years ago, I was talking to Mike Bono, and we were talking about basically understanding synapse fatigue. And the component that kind of came to my mind, and like when he was talking to me about it, was that I think that there's a level of, because of alternating current and because of the waves of energy, it still can probably be achieved outside of the speed at which we're working. But there is still something that we need to find the words to use, or find someone who has those words for us to use to best describe how our body fatigues when it's uncomfortable. And so, as we are kind of discussing today, I want you to put in the back of your brain that it is my goal out of all goals to get rid of terminology that maybe is incorrect in our industry, but at the same time, find what does work. And I think for right now, we can still utilize synapse fatigue in conversation, but I think that it is you should put a caveat in that space of it is similar to the body's response of synapse fatigue. And then we go into these explanations. And so we'll dive probably further into that. But that is really kind of the basis of this entire conversation. I just saw in the chat, my client slept for 45 minutes while I worked on her very whiskery chin today. I love that. I just take a nap, let me zap, we're golden. That is absolutely goals. It's wonderful to see when clients can just kind of get into the zone. So we're going to talk about the first part of this, which is what is pain and why does electrolysis feel different for everyone? So of course, one of the most common questions you get during a consultation is it painful, right? How long does it take? Is it painful? And how much does it cost? That's usually the trifecta of questions that they're most concerned about, outside of will my skin look okay? And it's hard to say if something's going to be painful or not when you simply don't know how that person perceives pain on the day-to-day. So the truth is that there is no single answer to if it's painful or not. I will say that there are certain areas of the body that traditionally are more sensitive than other areas, and they tend to be central of the body, or centered in any area, or in areas where it's bony or very thin skin, because there is more sensation happening in those spaces. But it's hard to say, oh, it's gonna out of a scale from 1 to 10, it's always gonna be a 5. We don't know, because one person might fall asleep. And nowadays, if you were to try and zap the few remaining hairs that I have left on my body for students to practice insertions on, if you were to do any zaps on that, my arms and my legs, I could take hair removal for hours. If you go after my face, I want to run in 5 minutes. And that is me, Stephanie Shields, a person who does not have the best pain threshold for electrolysis on my face. So when I talk to patients, I will explain that for me, my face is a difficult area, but my body is very easy. When I think of a patient I had this morning, she will sleep through her upper lip, and just kind of, even if she's not asleep, she just kind of chills out during that time for a full hour of terminal hair growth on her lip. And that is so cool to me, because I want to know what superpower we haven't figured out about her yet that she has, because that's very difficult for a lot of people. That's a high sensory area. And so when we're thinking about that, it's I needed injections. She chills out. That's what pain can be diversified in when we're talking to our clients. And so getting them to understand, especially during a consultation, that a sample treatment will help them understand their comfort level with the process before committing to really substantial treatment plans. And it gets you an opportunity to know how long, if they can tolerate 15 minutes, can they tolerate 30? If they can't tolerate 15 minutes, but they want a 3-hour appointment, guess what? We got to find a different way to go about this, because me chasing you around for 3 hours on the table when all you could handle was 15 minutes is less productive, and you paid more to get it done. So we have to start finding ways to navigate uncomfortable situations, and electrolysis is one. One of our comments says, for me, pain stays localized on the face, so it doesn't feel as intense as the legs, where I feel like the current travels through my body. And I would love to say in that space is, what type of current are you having in those two areas? Because when it travels through, what is your nervous system doing? Because some individuals are heavily charged, electrolysis terms, heavily charged by galvanic current. Others find it very tolerable. Some people, in this case, for you, thermolysis. Thermolysis for me, on my body, I would say it's like neither here nor there. Okay. Electrolysis, I can feel the waves, especially in multineedle. On my face, I can do some galvanic on my cheeks. Thermolysis everywhere else it's like my no-fly zone. So I get that. And I think that's a really important moment to understand that, like, those modalities can play differently in that space. We experience pain because nerve endings in the skin, and those nerve endings send the signals to the brain. We understand this when we're talking about A&P in electrolysis school, that our nervous system is incredible at sending sensories or sensations to our brain to allow us to know whether or not we're in danger or not. But also, if we are able to experience like elation, if we are able to experience cold and heat, and they're all very important. And how somebody responds to that could be very different. Uh, I can sit with a hot pad against my back for hours, but you put cold pad against my back for a minute, and I'm like, boom, like out. Um, Great question in the chat. Says, is it normal to see flashes of light during the zap if the eyes are closed with galvanic? So interestingly enough, some individuals can see current when their eyes are closed. Um, and I have not done a deep dive onto why that is, but I will say that I am one of those individuals that when my eyes are closed, I can see uh, the electrical charge. I don't know how to explain it, but it's like a flash behind the eye, behind the lids. Um, I would love to have someone come on to the class and be able to talk about what that is. I don't know who exactly I would ask in that scenario. I would probably say like a neurologist, but like, what is that? I sometimes think like when I was a kid, I accidentally decided to stick something metal inside of a electrical socket, and I wonder if that's the origin story of Zapmaster. Is that it just shot me across the room, and now I can see all charges when I'm getting zapped. Right? Um, it usually only happens when you're close to the area for me. So if I'm working on my legs, and you're doing electrolysis and I have my eyes closed, I would not see the sensation there, but I would if you were on my face. So kind of like interesting little tidbits. But I definitely feel like there is something to it. To what extent, and why it happens to some people, and they're more receptive to it than others, I'm not 100% on that one. So we know that like when it's everyone's nervous system processes these signals differently, as we're talking about here. Some clients do describe electrolysis like, with that minor prickling sensation, and others will then describe it as like sharp pokes. Um, I like to ask my clients, are you feeling it during the insertion when my pressure changes in my fingertips, or are you feeling it after my hand is steadied? Because if you're feeling it after my hand is steadied, that's telling me that you're feeling the energy. If you're feeling it during my insertion, that poke is I'm not in the right place, right? And so where I've selected a filament too large for the follicle, I'm not doing what's the right balance for myself during that time. So I would say that when you're asking your clients about sensation, be very specific in your terminology, because if, for example, you're like, do you feel a wave of energy or a poke? Well, they might feel a poke, and there's no way they would be feeling a poke in like galvanic current during that time. right? They're feeling usually that more poking sensation in thermolysis because it's so quick, right? But if they're feeling it during galvanic, I now know that something is off in my technique, because I need to do something different to make sure that they're not feeling that. Are there any areas of the body that are more prone to feeling the poking or probe? That they should never feel a poke if the insertion is correct. They should not feel a poke if the insertion is correct. However, they might feel the follicle, especially those who I've noticed are probably more neurodiverse, can feel sensation changes like a follicle stretch. Um, but I would say that if they are feeling that, you probably need to start sizing your probe differently, because they are feeling that expansion of the follicle, and that is not as ideal. Um, if you're feeling pokes when people practice on her toes in the chat, uh, most likely it's especially practice, they're probably missing the target. But if you're feeling it after they're in and the poke sensation is when they're in the follicle, then I would say that you're feeling the energy. So got to think about that. Now, if you're feeling a poke and you're feeling them move their fingers back and forth, right? So this happens in school when you see us kind of like, especially if you do galvanic or blend, we sometimes do movement back and forth with the probe. If we're moving too fast, you will feel that probe push against whatever closest barrier it is, and how deep you are in the follicle, how young that hair is, or how old that hair is. Obviously, you are going to feel the stretch of that tissue, but that's why we move nice and slow when we're working. Your insertion speed is consistent. It is the areas that you work in that gets you faster in electrolysis. So obviously a leg is going to be faster than a toe, because in a toe, you're having to move that digit around much differently than a leg that's already stretched out. And most of those follicles are in the same line. Think about toe hairs, like I think toe knuckles. All those hairs go like this, that, and the other, especially if they've been waxed before. And so if we're practicing, we're trying to figure out, am I going this direction, that direction? As an electrologist, I would say that especially in like your digits, your fingers and your toes, and you're doing a stretch in that area, having the opportunity to kind of pull the hand or pull the toe into your stretch will get you into a better space in that zone. But it also depends on if you're a one-handed technician or a two, because if you're a two-handed technician, you can't really comfortably pull that in the same direction as you could with a one-handed technician. Doesn't mean that's impossible. It just means that you have to find new and interesting ways to get there. So you might have more micro movements within your fingers. Some people definitely have substantially more sensitive nerve endings, especially when they are hypersensitive already, and then you're working in a hypersensitive zone. So upper lip, bikini, Brazilian, lips, fingers, toes, areolas. If you're working on someone assigned female at birth, especially somebody who has breastfed before, they tend to be a little bit more tolerant around the areola than those assigned male at birth, who haven't had that same sensation in that area. It's just a matter of like that sensory. But if somebody's like on a progesterone, that is going to make them more sensitive on their breast tissue. So then that area would then become more uncomfortable. Abdomen trail, I always say like center of the body is going to be more uncomfortable. Bonier areas tend to be more uncomfortable in that as well. Hormones do impact how somebody perceives pain as well. It doesn't mean that like if you have more estrogen or more testosterone, it's more painful. It is more along the lines that there are shifts in your hormones that your body is having to regulate something already. So it's already trying to receive sensations a little differently, and hormones a little differently, that you might see shifts in that place. And clients who are on hormone replacement therapy, especially estrogen, their skin sensation does get more sensitive over time, where someone that already has more established estrogen in their system and they might be going towards testosterone might have a little bit more resilience in that space. And it's just because one is kind of thickening and building, and the other one is more along the lines of softening and changing, kind of going into a more youthful space in that zone. So that will also change it. People who have had like chronic dermaplaning, microdermabrasions, chemical peels. I would say chemical peels are going to be into more of a sensitive area, but if they have a little bit more frequent rough treatments. Dermaplaning, honestly, is one of the big ones, especially if they try to dermaplane at home. And you know that patients think that they can go online and buy these things and be like, this is a great idea. And it was not a great idea. And it's really caused a lot of damage in those areas because they're not the professional in that space, usually. And so, I mean, you guys know that even professionals, we do stuff that we is pretty off label and we shouldn't be doing because we know better, but we still will sometimes attempt it because we don't have another electrologist. We might try to zap our own chin hairs. Is that recommended? No, because it's hard for you to see the insertion point. But do we still do it? Sometimes. I see that within the aesthetics world as well. Just understand that when we're talking to other professionals in these spaces, that we're trying to help them understand why they're experiencing some of these sensation changes.
This episode is brought to you by MEEC, the Maryland Electrolysis Education Center. MEEC is committed to providing comprehensive training and continuing education for electrologists at every stage of their career. Find out more about their programs at mdelectrolysiseducation.com.
Clients that have chemical peels or have had ablative or sublative treatments, resurfacing treatments, CO2, that kind of stuff, their skin is very thin. It's really turning over a lot. It's going to be more sensitive. And typically during those procedures, it's not smart to do electrolysis on the regular. If you're going to be chasing that healing pattern, give yourself a little bit more time in between services. I always say corrective care and electrolysis usually don't go well together, right? Because if I'm doing corrective care, then I'm usually doing something to like really change over, like get that cell turnover to happen. I'm getting a lot of shedding to happen. And I'm trying to like work with like retinols and that kind of stuff. During electrolysis, that would not be prime. That's kind of me making my skin more prone to then hyperpigmentation, prolonged irritation, prolonged redness, prolonged swelling. And so if you are doing both, you should probably have about 4 weeks, and both technicians should know that you're doing these and that you guys are in communication with each other. If you're in the same office, it becomes exponentially easier. And if you are the technician providing both, it then becomes even easier than that. So like an esthetician who's also an electrologist can do more corrective care closer to each session because they understand what they just did. In the same office, you have the ability to have their charts and look back and forth and see what they did and see how close it was to the service because you're sharing that space. If I'm doing this and I'm going to like totally throw somebody in both bus, and Michaela works next door, right? Thanks, girl. She works next door and she's doing all these chemical peels on my client. And I have to go and figure out like, where did you do the chemical peel? How deep was it? What are we seeing here? That kind of stuff. We have to have a better dialogue between the professionals and not necessarily rely on the client to be the one to shuttle that information back and forth. Because when clients shuttle information, they leave things out. Intentionally, unintentionally, it just happens because it's like, why was that important? I don't need to tell her all that. I'm going to give her the basics. And so then we're going, why was the skin reacting this way? What was happening? Well, they probably left something out of the dialogue that they actually had with their esthetician. And now they're in our chair going like, why is this happening? And you're like, what didn't you tell me? So that I can start to get to know that, right? We really want to know like what that difference is. Great question. How much time should we give in between the treatments? My favorite timing, if we're doing corrective care, I would say between 4 and 8 weeks, depending on the health of the client's skin to begin with. And I would say the more active melanin in their skin, the more time you should be giving them, or the deeper the correction, the more time you should be giving them. Same thing happens when we think about our patients that are having like facial feminization surgery, facelifts, blepharoplasties. If you have had a recent incision, and let's talk soft tissue first, and it's been less than 6 weeks, and I have to stretch any area next to that incision point, we heal from the inside out. Even though you might see the skin pucker and come together as it's healing, you still have to heal internally. And that's why dehiscence can happen in major surgeries and that kind of stuff, because you got a scab on top, but nothing was healed below. You just had the Band-Aid happen, right? And so as that's happening, if I'm going into an area and I'm stretching every which way, and I haven't gotten approval from the doctor, I could be taking on a higher risk. And that client could be really upset that their results weren't great. If someone's had recent bone work, those are conversations that we have to have further because bone work takes longer to heal than soft tissue does. And so some surgeons will stay longer between their electrolysis sessions. And that is a prime time, especially in gender affirming care, where you could kick off working on their surgical prep while their face is healing. So you can go back and forth. And that's when you can have a hyper focus moment on one single area so they can really get the ball rolling and not fall out of their treatment plan. And it then helps them because, like, when we do think about the pain factor, you guys all know that when we take a huge break in our electrolysis and then you come back into your electrolysis sessions, you like almost like have deja vu, that you knew there was pain. You just didn't remember exactly how it was going to present itself, right? You knew, like, you didn't, it wasn't like childbirth where you're like, whoops, I forgot what that was like. And then all of a sudden you're like, oh God, that really sucks, right? It's more like, I feel like this was uncomfortable for me before, and it's not until you experience it that you really understand that. And so we have to be able to have those communication points because if somebody's having all these procedures and their body is always trying to heal, you irritating just the little follicle unit is going to send them to a new area of discomfort that you have to then talk them off that ledge, right? And taking those big breaks kind of pushes like their results further away. But if we can toggle back and forth between a second area of interest, it can definitely help. See, this is why I have my notes because normally I would allow Joannie to talk here. So we know that like hormone stress, fatigue, when the clients come in and they're just like exhausted, you can have two types of clients there. You can have the person who's so exhausted that this was relaxing and they took a nap, right? Right. And all of a sudden you're like, we have a different life. Okay. And then you can have the other person, they're so exhausted that even the radio being too loud in the room makes their electrolysis more uncomfortable. Right. And so you have to start finding how the client's body responds to, for example, fatigue or stress. If they're not hydrated, oh my gosh, yes. In the chat, when they're not hydrated, think about how hard it is to pull moisture to that area when they're dehydrated. We know that hydration, whether you're doing AC or DC, so alternating current, direct current, right? Thermolysis or galvanic, depending on where you're at in your education. And that's why I'm giving you all the terminology here. I would say, like, we know that those expectations, there we go, of end treatment are going to be better when they have hydration in their system because we know AC is going to get those water molecules moving. We know the DC is going to help that lye grow, and moisture it's needed, right? And of course, we're all cute little cucumbers with anxiety. We have mostly moisture in our body, but when the skin is so asphyxiated, it becomes a problem and makes it more uncomfortable for that person to get through. Certain type of music recommendation. When great question in the chat as well. So yeah, find the music that makes them most comfortable. Make sure it's not something that's going to raise your stress in treatment. So the reason I say this is I am someone who I love rock music. I love some metal. I love some punk. That's like if you see me jamming out, not that I don't love pop music and musicals as well. Full transparency, I love music. But when I'm doing electrolysis, I'm not listening to punk music. That's how I'm cleaning the office, right? But if somebody wants to listen to that while I'm working, it needs to be in their ears. Like, don't listen. I got to focus here. I'll have something chill or something I can bop my head to and get that beat going, right? Because we love repetition as electrologists. And if we can get that beat that's consistent, that's helpful. That's why I don't necessarily like that music in that time frame, because if I have somebody screaming in my treatment room, well, great for cleaning my office, not so great for me to focus, right? Because it's just amping me up. So I would say find the music that makes them most comfortable. I would say areas that are more sensitive to work in and have a hinge, like a jawline. That should be a client that is silent, or you need to practice ventriloquism, right? Because you're moving more and I'm using a tiny filament to get into that follicle. That's a really small target. And you just made me have to go duck hunting at the fair on your face, right? I'm just trying to get somewhere. And so it becomes very difficult for me to provide you a comfortable service because you're like all over. And that is stressful in so many ways because you know they're going to get up from the table and they're like, did you get everything? And it's like, no, because we booked an hour and you talked whenever I said, please, silent in this place, and it ran me behind. I can't get it clear because it wasn't prime. So that's where you get to control the treatment room a little bit more. And if like a client is like, as you're talking to your clients and you go back and say, Stephanie said that you need to be quiet when working on the jaw. First, don't get me in trouble. Two, Stephanie is saying that you can find times to talk. But if it's an area that has to move and I have to get to that area, like a cheek is going to be an easy area for you to talk while I'm working. A jawline is not. If I'm underneath your chin and you're talking, you already know that that area is difficult to reach, right? You already know that like you're trying to find the angle and all the hairs are growing back towards the neck. And so if I'm trying to chase those follicles, it's going to be more uncomfortable. And you're going to end up with a higher chance of bruising, right? Because once again, I am trying to put a small filament into a follicle and you just gave me a moving target. I do love to see in the chat. It's funny to see how many clients can speak without much movement, and some are very expressive. So I enjoy having tattoos, and I got told by my artist that I talk with my hands, and it moves the rest of me, and I have to make sure that my hands stay under me when getting a tattoo because my Italianness will move my whole body, right? And it will be, I was getting my calf worked on and he was like, calm your hands. And so it is a funny thing. It is something that happens in those moments where it's like, oops, my bad. And you're like, I got to get that in there. Sometimes if I have someone that's super mobile or they're fidgety because they are uncomfortable, I give them something to do. Even if I'm not doing direct current and not doing anaphoresis and cataphoresis, one of the best ways to distract your client when they're uncomfortable is give them a task. Hand them a ground, even if it's not plugged into the machine, give them that because it does help. Okay. It does help kind of distract in those spaces. Using distraction tools, whether they're vibration, whether they're fidgets, as long as it's not moving the area that you're in, you're fine. The vibration tools, for example, amazing for certain areas to help kind of distract. But it's actually better to have it sit in a different area and pull the focus away than have it sit right next to what you're doing because that vibration tool against the area is now vibrating the area and you're in magnification. That is really hard on you. Stress balls, hold the ground. I love the little like forever popping things like I don't remember what they're called, but like the kids like it's like bubble wrap, but it's like forever. That's a great thing to give somebody. It's something that you can soak in some barbicide in between, and they're amazing. But anything that you can help that person distract themselves. The clients like mindset is really powerful, and so it's hard for me to sit in a place where I don't try to exude positivity, because this world can be kind of like a drag, and we're adults, and like we have to do a lot of the things that adults have to do, and that's a drag, right? And so I want my space to be someplace that you don't feel as much of that drag. I want you to feel empowered by what we're doing. I want you to feel comfortable in what we're doing. And so sometimes it's about how you set up that space. I'm a colorful person, as you can see in my background, right? I tend to have a very colorful space. Very clinical, like white spaces does not bring me the same kind of joy. People who also have that same personality tend to find me, and this makes them more comfortable. And so finding like minds between a client and electrologist, especially when they're first getting into the industry or first getting electrolysis in the industry, as they're doing their consult, especially if you might not feel that there's a connection there, have them meet with a few of your colleagues and see if they do have a connection with somebody. Most likely, if you are giving them some solid information, they're going to be right back in there and they're going to be more appreciative in that moment of the information you provided. But if you have to spend 1.5 to 3 years with somebody and you're already butting heads at the consultation, it will make every appointment exponentially more uncomfortable. Um, and it's hard because it is like, it's a vulnerable position to be in, and I'm glad that it makes sense because it's like one of those things that like, I don't want to tell somebody, hey, like we're not vibing, right? And like, your vibe attracts your tribe is in the chat. Absolutely. I want that connection for you to actually want to be here, because if you don't want to be here as much, and we already know nobody likes having the hair. That's why they come to the electrolysis office, because they want you to do something about it. But I need you to be happy to be here as much as possible. Obviously, growing out facial hair, having electricity run through your follicle, maybe not might be your Tuesday night happiness, but if I can find a way to get you into that space, you will find the treatment much more comfortable. I definitely tell my clients, like, breathe. There are some breathing techniques that I absolutely love when it comes to working in sensitive areas. I have them work with me as essentially at the beginning of their sessions. Like if I notice they're a little bit more jumpy, that I will show them, like, you're going to feel my pressure change in my hand even before the filament goes to your follicle. When you feel that pressure change, take a deep breath. And as I'm inserting and you feel me stop, exhale. And what happens is like, it kind of gave them like and they're able to get with the rhythm that you're working. What is important in those moments is if you establish a rhythm, don't all of a sudden change up that rhythm. Remember at the beginning of this, I said, when I was having laser done, we had to go 5 pulses at a time. 1, 2, 3, 4, 5, pause. 1, 2, 3, 4, 5, pause. If all of a sudden, and my technician was my mom, if all of a sudden my mom was like, we're going to go 20 pulses. I got this one last box. I was not ready for 20. I was ready for 5, right? And so you have to prepare them for that. Sometimes you get really focused on what you're doing and you're looking in this tiny little magnifier, and all of a sudden, like, the rest of the world is gone. And you were close to the lip when you started working, but you didn't realize how close you were to the lip. And all of a sudden now you're on someone's lip and you forgot to warn them that you were going to the lip, right? Those are moments that if we build that into how we navigate our treatment room, it makes it easier for a client to feel less pain. Establishing trust in the process, it does make a difference. People who are uncomfortable with you will be uncomfortable with your chair, right? And vice versa. That vibe, it's palpable. Okay. Same thing happens in a classroom, right? And then I'm sure that my students will hear this. Like sometimes I'm like, hey, calm, no circling the drain. Okay. We have to understand that this is a hard process to get through. Take a deep breath. It'll get better, right? Because if one person starts, and I know that my students, and we're not saying names in this, I know that my students will remember this, but we have patients that sometimes they'll come in together because it's models and students, right? And one person starts getting uncomfortable, and their friend, who can hear them because it's a classroom floor, is also now uncomfortable. And then they start playing off of each other. Okay. If you have someone that brings in someone who wants to gossip about family and get them all amped up when they're getting work done, that's not going to be beneficial, right? It's cool to spill the tea, but if the tea makes you stressed out, don't do it, right? You need to be able to like get into that space. I mean, the tea is good, but at the same time, the tea is not always good during electrolysis. And I'm here to make it as comfortable as possible.
This season, Electrolysis Unplugged is spotlighting our groundbreaking research project. We're working on bringing legitimacy, data, and recognition back to electrology. If you're a practitioner ready to contribute detailed charting and client outcomes, or a student interested in learning the process, visit electrologycoalition.com. Look under research and get involved today. Together, we're writing the future of electrolysis.
So when we insert that filament into the follicle, like sometimes we have to explain to our clients what's happening. So a way that I explain it is like sensory nerves are the things that are like responsible for detecting the pain and temperature and touch. And so what we're doing is we are in a space that those sensory nerves are going to be alert and waiting to tell the body and the brain that something is not right And so we need to be a little bit alerted in case we actually aren't going to be okay. Right. And so sometimes by not warning clients, their body can't prep in those spaces. Obviously, your nervous system can react without you thinking about it. But we need to think about how we navigate those waters. And a lot of times it's about understanding what's about to happen. The reason that you're feeling these sensations is because of those sensory nerves, and they're the same sensory nerves that allow you to understand what pain and temperature and touch feel like. And then sometimes that helps them understand, like, oh, yeah, if I touch the stove, okay, I know now that that stove was hot. Don't do that again. Right. But now they're on your table and they keep touching that stove, every couple seconds with new hair. And so they have to get into a place where they're like, I need to understand how to calm my body, knowing that I'm going to be touching that stove over and over. Sometimes we hit that spot that can trigger a slight twitch, and that's usually because the follicle is close to a motor nerve, which then controls obviously your muscle movement. So if you see someone getting that little especially like you can sometimes see it kind of in the corners of the mouth where doing galvanic current, sometimes they'll activate this a little bit more, where their mouth will kind of like pull upwards and inadvertently smile. Um, Yes, the Hensley and Huxley nerves endings. Yes. Sorry, is it that? Um, it's corresponding to that. Yes. Hold on. Oh, I'm seeing that I missed a question. Do sheets versus paper on table have any impact on clients' comfort? Um, let's say yes and no. Okay. Yes, obviously sheets are more comfortable. Um, but they're harder to launder. And so I personally don't take that into consideration in that space. I just go with paper because years ago we used sheets in our practice and we do a lot of pubic work. And I had to do hair removal twice every day, once during the session, and then once like after laundry. And that's just because those little curls get hooked in those fibers. And so you have to go with something that has tight enough like locks in the stitching that it's less possible. Um, but yeah, I mean, like it's cold out right now, or at least where I live. And I think that a client would be more comfortable when having, especially Brazilian work, where more of their body is exposed, even if draped, to have a nice warm sheet over the top of them than they would for me to be like, here's your chuck pad, enjoy, because that might be a little bit uncomfortable. Um, and yeah, this is another thing. Some of the state regulations make sure that you have to have disposable paper. Some of them will say no to having sheets. Um, okay, is the motor nerve that I explained the same as someone's leg twitching during laser? Yes, it's basically that response is close enough to that nerve that if you're getting movement, it's a motor nerve. Okay, if you're getting sensation, okay, but no movement, sensory. They both can happen. Oh my goodness, it's as if like, you guys, my partner in crime finally showed up. It's as you're having those sensations in different places. But I will say that for myself, I went going back to the sheets versus table paper. I'm personally a table paper person. And that is only because I just don't want to do hair removal on my sheets ever again. And I don't want to figure out by buying multiple types of sheets which ones do it less. Um, Having a school, I also don't like having to. When we first opened the school 2 years ago here, uh, that was an experience because I wanted to do sheets, thinking, "Oh, that's a great idea," and then I realized that I had to do the laundry because I was the one with the washer and dryer, and that was the worst idea because I already have to do that in a family, and I don't even want to fold my own clothes. So that's why I have so many hangers. And that's like one of those things like you have to think about those things. Um, So going back to like what we're expecting, like when the client has like the twitching and that kind of stuff, if you think about like working on their eyebrow and they have that little twitch happen, you're probably getting close to that motor nerve. It Be careful in thinner skinned areas. If you know that someone's prone to twitching, um, especially near the eye, for example, guess who gets to have a shiner if we're not being careful, right? If I know that you are a twitcher, I'm going to have to stretch a little differently to see if I can stabilize that area without chasing the twitching nerve or twitching muscle. Um, just so everybody knows, Joanie is in the chat now, but she's all acting silent because she came in later. Just so everybody else knows, or Joanie, I have a whole note section because I was like, I can't be alone.
Yeah, I'm so sorry.
That's okay.
Couldn't be helped. So I tried to jump on the last 20 minutes. So I'll just be another square listening to you.
Okay, you got it. I can do this.
No, I got you. But I'll jump in, I guess, whenever. What are we talking about? Let's recap.
The science of sensations and electrolysis, the pain
Okay.
and how we're going through right now. We're talking about our nerves, our sensory nerves and our motor nerves, and understanding like where those can kind of like be activated. Whether if we're seeing a twitch, we're going with a motor nerve. Or we're seeing a pain receptor, we're going with a sensation, right? Or a sensory. And sometimes you can get both, right? And that's what I was gonna say is there is a time where you're getting twitching and they can feel everything, and you're like, well, that sucks. You're having to work through those moments to find their nice piece on the table, and that you're not having to chase a hair follicle and give them a bruise. Joanie, have you ever had anybody on your table end up with a shiner?
It wasn't quite that extensive. It happened once, and it was a little bruise. And it's funny because you see it happen and it's flat and it goes, right?
Yeah.
Like, no, and you put pressure right on the area.
Yeah.
But yes, it happened once. After that, yeah, I learned my lesson. It's called calm down, slow down, take your time, right?
Simmer down. We do not fast. We need to be
take a breath. Yeah, exactly. Yeah, there's some areas it's important to slow down, just for the sake of accuracy and, doing a job and making sure that you're just not cutting corners and causing things like that.
When I've definitely, caused a bruise up on the eyebrow for certain, and the neck. That's another area, especially if you got a person who's mobile, and you're chasing them. Those are areas that can happen. I will say that when you're working with older population that has like poor healing, those are things that can happen more frequently.
Yeah.
So understand, because that happened to actually one of my apprentices back in Arizona, where I heard my name, Stephanie, through the halls of the office. And all of a sudden I was like, I don't know what's going on, but I'm going to go figure it out. And unfortunately, it was an elderly woman that had really thin eyebrow skin, and she hit it just right. And it was like a sizable bruise. And that's just one of those moments that you feel so bad. Her patient was so gracious about it. She was totally cool, but it doesn't make, them going away. You don't feel good about it. And so, and did it hurt them? Possibly, but sometimes not at all. I mean, like, it just depends on how fast you were going.
The skin is so thin. The vessels are just, it's so vascular around there. Everything's so fragile. It's not necessarily, I mean, obviously you got a bruise. It's because the insertion was off, but that being said, it doesn't take much. So sometimes it's like a little off and it can happen, especially in that area.
Yeah. A question that we had was, do you keep ice in your practice? I keep the instant ice. I used to keep the ones in the freezer. Honestly, we were tossing it either way because it was like a single use. That going to the breakable ones meant that I didn't have to take up a freezer in the office. I didn't have to like remember that kind of stuff. It was in front of my face. If it's in the freezer, I'm not paying attention. I don't do ice in my glass. So it's one of those things that I'm rarely in there.
And less of a mess too, if you have those packs. Yeah. Because the water melts, it goes everywhere. And then they can use it during the session, even if it's,
I do love that. Using those instant ice packs, and they have instant heat packs too. Not that you would do that during electrolysis, but like if for example, somebody was trying to find different ways to get through electrolysis, you can give them something warm.
Mm-hmm.
But basically, if you can distract that brain while you're working, it's just going to help you more and more.
Michaela said that she uses a wet paper towel that she freezes in a plastic bag. So pretty much it makes like a little water balloon, I guess. So yeah, that's another good thing. If you kind of paper towel, get it wet, put it in one of maybe like a snack pack size bag or something. You can freeze those ahead of time, and then they have little ice packs.
Someone told me if you add a little bit of rubbing alcohol to it too, it kind of has like a icy texture.
I've heard that. Yeah.
I've never attempted it, but I really like the idea of a paper towel in the bag. I don't use latex in the office. So I also wouldn't carry balloons or latex balloons in the office. And when they do show up here, I am quick to usually get them out of the office because latex allergies are so high out there. I just don't feel like being the reason that somebody is having a reaction. In fact, I'm an organizer for our local Pride, and we do a latex-free Pride because, like, a lot of the balloon arches are very popular. And there was one attendee out of a couple thousand people that were there that had a severe allergy to it, and you have to just think about that. Filling up a glove, it can cradle the face. That is actually a great idea, especially if you found a way to shape it to like what the hand would be. Oh my gosh, that's brilliant. Like, boop, here, hold that. But I have used the nitro gloves that way.
Mm-hmm.
I also, whenever people, this is when I was more of like on the clinic side of things. When people would bring in their kids, I would always blow up a hand glove and give them a chicken. Because it gave, like, they thought that was the coolest thing ever. And I spent like, a cent to give them something to distract them the entire treatment. And now all of a sudden they have a chicken, right? And so the mom's not worried about it. They have their hand chicken. Gloves are very versatile in the office. Okay. Things that can influence electrolysis sensations. So if we think of like going session to session, clients that have substantial changes in hormone patterns, medications, have had recent antibiotics, have recently had the skin resurfacing stuff, that sensation could vastly change how it feels. So it's important to kind of get to know your clients. I have some clients that assign female at birth that when they're ovulating, they're more sensitive. And I have other clients that when they're menstruating, they're more sensitive. And I have some clients that are never sensitive, and then some clients who are always sensitive.
Yeah, you definitely have to get to know. Yeah, you have to get to know people's quirks. I have some clients, they were more sensitive if they came in the morning, and others, that's their prime time of the day. And then others, it was after work. They were, it just so depends because sometimes, yeah, like at the end of the day, you've got your whole work day, in under your skin. And then here you are getting zapped at for an hour. And sometimes that's just too much for some people.
Oh,
So
yeah.
they do better morning appointments, coming fresh from sleep, nice meal in their stomach, good to go.
That is such so are you like zonked and like you're barely waking up and that's why you can handle my table?
Mm-hmm.
Or do you have a high stress job? And so I am the least stressful thing in your day. So
Yeah.
after work, I mean, you have to think about those things. So
Exactly.
skin hydration, moisture levels, those are huge impacts when changing sensation in those spaces. So like if there's dry skin, there's going to be like more resistance. It could be just more reactive. So that's why we talk about doing like at school, we do anaphoresis at the start of a treatment because we're trying to like pre-treat. Caffeine, that's a great one. And that Michaela said, caffeine's another one. I will say that some individuals, especially those who have like ADHD, if you remove the caffeine, it actually makes them more sensitive than others than if you put the caffeine in. So you have to think about, does caffeine make you tired? And this is a great question for you. Like, can you have like a cup of coffee and go to bed? Or will a cup of coffee keep you up all night? Because I need to know what that's going to be. Clients, none of us can tell somebody what medication to take, but there are things, especially if they have a driver that they can, like if they took a Benadryl, while I would never tell someone like they have to do that conversation with their doctor and they have to be driven. Because if someone takes a Benadryl for a 15-minute session or an hour-long session, trust you're still feeling that Benadryl after that session. And so I need to know that you're safe, right? And you can't hang out at the office all day. So while you can take medications that will suppress the pain, I don't recommend it unless you have a driver. And in most cases, if you do have a driver, I need them not to be in the office during that time. I need them to kind of come and go because you might have a limited space in that zone. So like I will tell the driver when to come back. But kind of like when you're at the dentist and they give you like a sedation, you have to make sure that you're safe going back and forth.
Yeah, I've had a lot of clients that came in like, if they had smoked like smoked weed or, drank, or they take, they have some heavy duty painkillers from some procedure they've had, and they're saving them and they're using them, and so they can be on some pretty hefty stuff, and you have to be careful.
And like that's one thing to think about is like utilizing stuff that might be a diuretic or dehydrate you. So pain medications can dehydrate you. THC can dehydrate you. Alcohol can dehydrate you. I sometimes like clients are like, nothing is like everything that I would expect to work on them because it always does. And they come in for that one session. I'm like, what'd you do last night? And I joke with the students about this. Like if you had, it was Taco Tuesday and you had all the tacos and the margaritas, you're probably going to be pretty like dry the next day. And you got to get some water in that system. So utilizing stuff like anaphoresis in that space, or just taking after you've cleaned the area, like a mild, like a witch hazel or like a tonic K. Am I saying that right? I think I'm saying that right.
Yeah.
So if you're doing that one, those are great to kind of like just take a little bit of that dryness off of there.
But also it's important to mention that, hydrating like via liquids and things like that is good as long as you do it 24 to 48 hours before your session. So like drinking a gallon of water as they're walking into your room is not, it's not going to do much except make you have to go pee every 5 seconds.
It's funny because Laura on the call, we have this one patient that for surgical prep, we could not get them to stay for 5 minutes on the table and was always going to the bathroom. And at first I was like, sometimes people like have to run to the restroom because they're in pain, right? And other times it's because they've had a lot of water, right? Or a diuretic. So in that space, I walked in there and I would say that I was like, like, have you been drinking water? Like, you've been going to the bathroom a lot? Like, and she's like, oh yeah, I like loaded up on my 2-hour train ride down. And I was like, girl, it is not the 2 hours before, because that's why you're having a potty break every 5 minutes now. It was yesterday and taking all that in, and then adding in electrolyte. And then, I wouldn't say witch hazel is hydrating. I would just say, like in the chat, Sheila says, did I say that witch hazel is hydrating? It's not that it's hydrating, but it's not going to be like stripping the skin as much as the alcohol would. So if you were to clean off the area and then follow that up with a swipe of that, you don't want to have like wet skin, because think about this. If your skin is wet, that is an area that is more conductive on the surface, right? And if you made a mistake of having a shallow insertion or a mobile client or whatever, now my insertion, if that point effect gets to the wrong point, I don't want it to be on the surface, and I don't want it to be in a more charged area again. Yeah.
Well, I always tell clients, electricity likes water, so that's why it's important. But you want that water to be where your target is, right? So exactly. If you've got like putting lotion because the skin is there, leaving numbing cream on and working through it, right? So anything that would be a conductor shouldn't be on top of the skin when you're working.
Also, if you're keeping product on the surface, you are not able to stretch that skin.
No.
Your insertion will not be where you think it should be.
No.
Take the product off of the area. It will. And for anybody that has a client that's like, you have to work through it. I have to have the numbing cream on. That is up here, and we need to work on up here first, because that numbing cream does nothing if you just put it on. You need it to saturate in that skin so that they can have that relief going forward. And then, yes, electricity loves water. And that's why we have to say that, because they have to understand that I'm using that to my benefit. And if you're using it against me, then at some point it can be counterproductive. So I would probably have gone on for a lot longer today. But I will say that today is my anniversary. And so I think that we'll call it here so I can go on my date. And you guys can have a lovely evening doing whatever you need to do to recharge for your workday tomorrow. And if you're off tomorrow, woosah, that's awesome. But thanks for listening to me by myself for a little while. Joanny, thanks for actually like hopping in when you were available. We're sorry that thank you, hon. But thank you for popping in here. Because I was like,
missed it.
hopefully y'all didn't feel like, oh my gosh, this woman will not stop talking. But I'm glad to have you guys all here. And we're back on next week, same time.
Yeah, next week, same time.
And if
I'll be
you're in
there.
the research committee, we're on tomorrow morning.
That's right.
Here. So bye, guys.
Thank you, everyone.
You're welcome.
Thanks, Stephanie. Happy anniversary.
Thank you.
Thanks for tuning in to Electrolysis Unplugged. We hope today's conversation gave you something you can take straight back to your practice. Don't forget to share this episode with a colleague. And if you're part of our mentorship community, continue the conversation with us there. Until next time.